Welcome to This Explainer. Okay, let's dive right into a really critical global health situation that's developing in Central Africa right now, one that honestly requires our immediate focus. The eyes of the entire international medical community are firmly fixed on the Democratic Republic of Congo. There's a rapidly evolving health crisis unfolding there, and it's prompting some incredibly swift and serious action from global health authorities. We're going to break down exactly what's happening, why it actually matters to the rest of the world, and most importantly, what's being done to contain it. So, to really understand the scale of the World Health Organization's recent emergency declaration, we have to start with the single most pressing question you're probably asking today. Just how worrying is this specific outbreak? Look, every time we hear the word Ebola, it naturally sets off alarm bells, right? But to truly assess the danger level here, we need to kind of strip away the panic and look directly at the hard data and the specific viral strain involved. When we talk about viral outbreaks, it's super easy to get lost in the abstract. But currently, we're looking at around 350 suspected cases and 91 deaths reported by the DR Congo's health ministry. These aren't just statistics. These are fast-moving numbers in the eastern Ituri province that signal a highly lethal, aggressive viral presence that authorities are absolutely rushing to track and contain. And honestly, this next number is exactly why this story has escalated so rapidly in the United States. According to sources speaking to CBS News, at least 6 Americans have been directly exposed to the virus. When a localized outbreak suddenly touches international citizens, the whole public health response shifts gears completely. We're talking high-level coordination between multiple governments overnight. Section 1. Americans exposed and evacuated. Okay, here is an absolutely crucial point. We have to differentiate between exposure and confirmed infection. While one American is believed to be showing symptoms and 3 others had what they classify as high-risk contact or exposure, we do not yet have confirmed infections within this group. The situation is really fluid, and health officials are understandably treating every single individual with the highest level of caution until their status is definitively known. To manage this, the U.S. response is actively developing as we speak. The Centers for Disease Control and Prevention is currently coordinating the safe withdrawal of this small group of affected Americans. Interestingly enough, the health news site Stat is reporting that the government is actually looking to transport them to a safe quarantine location. Unconfirmed sources suggest that might even be a U.S. military base in Germany. It just really highlights the intense, complex protocols required to safely move people without risking any wider contamination. Now, while the CDC assures us that the domestic risk to the United States remains low right now, their actions abroad tell a story of extreme caution. They've actually issued a Level 4 travel advisory. That is their absolute maximum severity level, explicitly warning Americans against any travel to the DR Congo. This dichotomy, low domestic risk but maximum international warning, really underscores just how severe the situation is on the ground in Africa. Section 2. The Bundibugyo virus strain. The absolute core of this crisis is the Bundibugyo strain of the Ebola virus. And what makes this so incredibly alarming is that, unlike some other strains we've battled in recent years, there are currently no approved drugs or vaccines for Bundibugyo. That essentially means our modern medical arsenal is stripped of its best weapons, making traditional containment and isolation literally our only real defense. Because there's no medical cure or preventative vaccine available, the WHO is urgently warning that this situation could quickly snowball. They've explicitly stated there is a significant risk for local and regional spread. What we are seeing right now might just be the tip of the iceberg, with the agency cautioning that this could easily turn into a much larger outbreak than what's currently being detected and reported. And regional spread isn't just some theoretical warning anymore, it is already a reality. Viruses don't respect borders, right? The CDC has confirmed that the virus has already crossed into neighboring Uganda, resulting in 2 confirmed cases and 1 death. Once a virus starts hopping international borders, the complexity of tracking and containing it just multiplies exponentially. Section 3. Preventing regional spread. So what's the game plan? Well, the global defense strategy relies heavily on the WHO advising both the DR Congo and Uganda to undertake strict cross-border screenings. They're also demanding enhanced preparedness from all nearby countries, which basically means setting up intense surveillance at local health facilities and deep within communities. Every single suspected fever or symptom absolutely has to be caught early. We are already seeing nearby nations step up to form a regional shield. Rwanda recently announced it's tightening screening along its border with the DR Congo as a vital precautionary measure. Meanwhile, regional powers like Nigeria have publicly stated they're closely monitoring the situation. A highly coordinated regional network is really the only way to box this virus in. Now, Jean Kaseya, the Director General of the Africa CDC, highlighted a really dangerous intersection here between deeply held cultural practices and viral transmission. In the absence of medicine, changing human behavior is basically the only treatment we have, and funerals are a massive, massive flashpoint for infection.
See, the crucial point here is understanding the cultural context. Traditional community funerals often involve family members intimately washing the bodies of their deceased loved ones. Unfortunately, the Ebola virus is extremely contagious in the bodily fluids of the deceased, so this intimate act of mourning provides the virus a direct, highly concentrated pathway to a completely new host. That's exactly why strict, safe funeral guidance is a top public health priority right now.
Section 4. Lessons from past outbreaks. Right now, health officials are desperately trying to prevent a repeat of history. Today, we're looking at around 350 suspected cases in the DR Congo. But think back a decade ago. During the catastrophic West Africa outbreak between 2014 and 2016, more than 28,600 people were infected. The goal of every single intervention happening today is to make sure those current numbers never even get close to the numbers we saw back then. That massive 2014 to 2016 outbreak ultimately resulted in an agonizing 11,325 deaths. Let that number sink in for a second. It serves as a really grim, historical reminder of the virus's potential lethality if it's allowed to spread unchecked through dense communities and across porous borders. That historic, devastating outbreak was literally the worst we've seen since the Ebola virus was initially discovered way back in 1976. It was a total watershed moment in global public health. It fundamentally changed how the world funds, tracks, and responds to infectious diseases, teaching us the hard way that reacting slowly is a fatal mistake. And those past events show us exactly why this is a true international concern, not just a localized African issue. In 2014, the virus tore through Guinea and Sierra Leone, but then it completely escaped the continent. Cases popped up in the United States, the United Kingdom, and Italy. In our era of modern air travel, a local outbreak is only ever one flight away from becoming a global crisis. However, before we get too panicked, it is vitally important to remain calm and focused on the facts. Yes, the WHO has officially designated this an international emergency, but they've also clearly noted that this specific outbreak in the DR Congo has not yet met the criteria for a global pandemic. The systems designed to catch and isolate the virus are actively deploying as we speak. So, as we wrap up this explainer, we're really left staring at the ultimate question. Will these strict, rapid public health measures, the travel advisories, and the cross-border screenings actually be enough to stop a virus with no cure? Can we successfully contain the untreatable Buntibujo strain before history repeats itself? It's an incredibly high-stakes race right now between a relentless virus and the global health community's ability to act swiftly together. Keep an eye on those case numbers in the coming weeks. They're going to tell us exactly who is winning.